Am I in need of a blepharoplasty procedure for my under eye area? I was advised by a surgeon that I need to remove my under eye bags. Is this the best choice for my case, or is going for fillers a better option? My sister has done fillers before for the tear troughs, but it was overdone, and her under eye area seemed to be more protruded and swollen all the time.
Thank you for your question. You submitted a photo with your eyes looking upward, and you asked a very good detailed question. You're asking if blepharoplasty for your under eye bags is appropriate, and you've also wanted to learn more about fillers, and you describe a situation where your sister had filler done for her tear troughs, and unfortunately it created this swollen, undesirable look that naturally it makes sense that you're concerned about. So I'll share with you my approach to helping people who complain about under eye bags. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I'm a specialist in eyes when it comes to complex eyelid surgery, reconstructive eyelid surgery, revision eyelid surgery. And so under eye bags is one of the most common things we deal with. For many years, the approach to under eye bags was very straightforward. It was always a surgical option. Then with the development and continuous expansion of the use of hyaluronic acid fillers, an additional option became available to help soften the appearance of under eye bags. Naturally, there are many people who are averse to surgery, as well as a lot of doctors who are averse to referring people for surgery. And so, unfortunately, a lot of people who are not good candidates for fillers to camouflage the puffy bags end up with a distorted appearance. Now, this may not be the case for your sister. She may have mostly had hollows. You see, when we use hyaluronic acid fillers to fill hollows, it's wonderful. But again, there's an art to it, there's a strategy, and there's a challenge. Everyone responds to hyaluronic acid fillers differently. You see, when hyaluronic acid fillers were originally used, it was mostly for areas where the skin was thicker, the nasolabial folds, the lips. But when you apply it to the under eye area, the potential for irregularities, swelling, lumpiness became more likely because of the nature of the technical aspect of placement, the viscosity of the material, and the amount of swelling. So we routinely follow our patients kind of closely, and when we do this as an option, but to answer the question about the puffiness, in your situation, at least from the photo you submitted, you're likely to be a candidate for lower eyelid blepharoplasty. I always teach my patients in this discussion that if the fat pocket which is moved forward, and this is called lower eyelid fat prolapse, which means the fat that's normally around your eyes pushes forward, creates this bulge, and we call another term for it is herniated fat. If that herniated fat is beyond a certain threshold, then no amount of filler will camouflage it adequately, and in fact it can actually make the bags look more prominent. We use an enzyme called hyaluronidase to help patients who come to us from everywhere, who become kind of bloated, and once they become like that, they don't want to go back to their doctor, and they come to us, and we use hyaluronidase to dissolve it. And sometimes it takes more than one session to be able to accomplish the endpoint to where you actually see their actual anatomy. So in your situation, you're young and you have puffy bags under the eyes, we routinely do a procedure called transconjunctival blepharoplasty. What this means is we're dealing with the fat pockets from the inside of the eyelids. By doing this from the inside of the eyelids, there's no external incision and there's no sign that you've had surgery. The key to all of this is doing it in a very strategic way, in a very artistic way, and doing it in a way so that you can recover quickly. In our practice, we routinely do this procedure under local anesthesia with light intravenous sedation. That means you're not under general anesthesia. You get an IV or intravenous, you're given the equivalent of liquid Valium, and you are able to relax while this area we work on. We do the procedures in our own office operating facilities, which are certified by the Joint Commission. Joint Commission is the body that certifies hospitals, surgery centers, and they set standards for patient safety, which naturally we are all for because this is an elective cosmetic surgery and you want to do it in the safest way possible. So with that understanding, I'd recommend you meet with qualified, experienced cosmetic surgeons. Coming from a specialist background, I can tell you that there are many complexities to eyelid surgery that are underappreciated by general plastic surgeons, board-certified plastic surgeons who have a more general training scope when they do their residencies in terms of majority of their residency experience. So basically finding the right specialist who you feel comfortable with, who you feel is going to be able to deliver a great result, and you can get that sense by looking at their before and after photos. I've been in practice for over 20 years, so my patients appreciate seeing how many of these surgeries I've done. And before there was digital, we have big albums which people sit and thumb through the results and try to match their appearance with the appearance of patients in the book. And so you can, once you feel comfortable, I would suggest moving forward. It's a great procedure. I will say that if there's one procedure that someone's going to do on their face their entire life, it'll be to address the under eye bags. It has a very dramatic effect on the overall facial appearance. It's almost like doing a facelift in many ways. So I hope that was helpful. I wish you the best of luck. Thank you for your question.